SSI, SSDI, and Social Security have just been updated today. Here is exactly what you need to understand right now. If you receive SSI, SSDI, or Social Security benefits, pause whatever you're doing and focus. Because beginning today, April 25th, 2026, the rules have officially been updated. This is not speculation. This is not something happening later. The Social Security Administration has introduced a major policy change today, and millions of seniors across the United States are unaware of how it could directly affect their monthly payments, their eligibility status, and their financial future. We are discussing updates that could mean additional money for you or a significant reduction if you overlook these important deadlines. Whether you are already receiving benefits or planning to apply soon, this directly affects you. Are SSI income limits being updated? What about SSDI work guidelines? And how will this impact your Social Security payment starting this month? These are the exact questions we will address clearly and simply in everyday language. No complicated government terms, no confusion. Everything has been explained step by step, so you understand exactly where you stand, what is changing, and most importantly, what actions you need to take right now to protect your benefits. Let's begin. What is happening right now? The Social Security Administration, SSA, has introduced a series of changes that take effect starting today, April 25th, 2026. These are not small updates. These are meaningful adjustments across three of the most essential benefit programs in the country: Supplemental Security Income, SSI, Social Security Disability Insurance, SSDI, and regular Social Security retirement benefits. All three programs are being updated simultaneously, and that is why this moment is so important for so many Americans. Let's begin with SSI because it impacts some of the most financially vulnerable individuals in the country. SSI changes. What you need to understand. SSI is a needs-based program, which means it is not determined by how long you worked or how much you contributed to Social Security. It is based on your current financial condition. For many years, honestly for decades, the rules surrounding SSI have been extremely strict and in many situations quite unfair. One of the biggest concerns from SSI recipients has always been the resource limits. Until very recently, if you had more than $2,000 in your bank account, just $2,000, you could lose SSI entirely. If you were married, that limit was $3,000. Think about that for a second. In today's world, where a single unexpected expense like a medical bill, car repair, or home emergency can cost thousands of dollars, the SSA was essentially telling SSI recipients they could not save money, not even a small emergency fund. If you saved even a little, you risked losing your benefits. That is not a system designed to help people improve their situation. That is a system that keeps people stuck. Now, the positive news, and this truly is meaningful, is that things are starting to change. The SSA has faced significant pressure from advocates, lawmakers, and families nationwide to update these outdated policies. While full legislative reform is still pending, the agency has taken administrative action to change how certain resources are counted under SSI. This provides more flexibility for recipients when it comes to what counts toward the resource limit. There are also updated interpretations regarding how certain types of income are treated. Now, let me be clear, so there is no misunderstanding. The base federal SSI payment amount has also been adjusted. As of this year, the maximum federal SSI benefit for an individual is $943 per month. For a qualifying couple, that number increases to $1,415 per month. These figures reflect the annual cost of living adjustment, COLA, applied by the SSA. Now, I know many of you are thinking $943 per month is not a lot, and you are correct. It is not enough, but it is an increase compared to before. Combined with the other changes taking place, the overall situation for SSI recipients is somewhat improved today compared to yesterday. One of the most important updates involves how the SSA evaluates what is called in-kind support and maintenance. This concept has caused confusion and hardship for many SSI recipients over the years. In-kind support refers to assistance such as food or housing provided by someone else. For example, If a family member allows you to live with them or helps pay for groceries, the SSA previously reduced your SSI benefit because of that support. Essentially, people were penalized for receiving help from family. Many viewed this as deeply unfair. The idea that support from loved ones would reduce benefits did not make sense to most people. Under the updated rules, the way in-kind support is handled is being simplified. In many situations, certain types of family support will no longer reduce benefits in the same way as before. This is a meaningful improvement for individuals who depend on family assistance to manage daily living expenses. Now let's move to SSDI changes, including work rules and substantial gainful activity. SSDI operates differently from SSI. It is an earned benefit, meaning you must have worked and paid Social Security taxes for a certain period to qualify. The amount you receive depends on your earnings record, similar to Social Security retirement benefits. SSDI is designed for individuals who are unable to work due to a serious medical condition expected to last at least 12 months or result in death. For SSDI recipients, one of the most stressful aspects has always been what happens if you attempt to return to work. Many individuals want to try working again, even part-time, but the rules have often felt complicated and intimidating. The concern has always been, if I attempt to work and it does not go well, will I lose my benefits? Will I need to reapply from the beginning? Will I face long delays waiting for approval again? The SSA uses a standard called Substantial Gainful Activity, SGA. This determines whether a person is considered able to work. If your earnings exceed the SGA threshold, the SSA may decide that you are no longer disabled under their guidelines, which can affect your SSDI eligibility. For 2026, the SGA limit for non-blind individuals has been updated to $1,620 per month. For individuals who are blind, the limit is higher at $2,800 per month. These numbers are important if you are considering working while receiving SSDI because you need to understand exactly where the threshold is. There is also a feature known as the trial work period, which is a valuable protection that many people do not fully understand. The trial work period allows you to test your ability to work for up to 9 months. These months do not have to be consecutive and can occur within a 5-year rolling period without affecting your SSDI benefits. During these trial months, you receive your full SSDI payment regardless of how much you earn. The threshold that determines what qualifies as a trial work month has also been adjusted for 2026, and it is important to confirm the current amount directly with the SSA or through a benefits specialist who can guide you based on your situation. This matters because for individuals with disabilities, trying to work is not just about income, it is about independence and confidence. The ability to attempt work without immediately losing benefits gives people the freedom to explore their capabilities without fear that one successful month will jeopardize long-term support. The updated rules around trial work periods and disability reviews aim to provide more flexibility, which is a positive development. Now let's discuss Social Security retirement benefits, including COLA, and what it means. This is the program most people are familiar with. If you are close to retirement or already receiving benefits, you need to understand what is changing and how it impacts your monthly income. The most recognized yearly update is the Cost of Living Adjustment, COLA, for 2026. This adjustment has already been applied to payments. COLA is based on inflation data, specifically the Consumer Price Index for urban wage earners and clerical workers, known as CPIW, which measures how prices are changing for everyday goods and services. The COLA increase this year has resulted in higher monthly payments for over 70 million Americans receiving Social Security. While the exact increase depends on your benefit amount, the average retirement benefit has reached a higher level, providing some relief against rising costs like groceries, utilities, and health care. However, there is an important detail many people overlook. While COLA increases are beneficial, other factors can reduce that increase quickly. The most significant factor is Medicare Part B premiums. For most beneficiaries, the monthly premium for Part B, which covers doctor visits and outpatient services, is automatically deducted from your Social Security payment. If that premium increases at the same time your benefit increases, part or all of your COLA adjustment can effectively disappear. So when you review your payment increase, also check the deductions. The actual amount deposited into your account may be smaller than expected. There is a protection known as the hold harmless provision. This rule ensures that your Social Security payment cannot decrease from one year to the next due to an increase in Medicare Part B premiums. In other words, if a premium increase would reduce your payment below last year's level, the SSA limits how much is deducted to maintain your prior benefit amount. Most recipients are protected by this rule. However, if you are newly enrolled in Medicare or have higher income levels requiring higher premiums through income-related adjustments, this protection may not apply. Understanding how these adjustments work is important and may require guidance from a Medicare advisor or benefits specialist. Now let's talk about the earnings test for individuals who are still working while collecting Social Security. This mainly affects those who have not yet reached full retirement age. This area often surprises people and can have financial consequences. The SSA applies an earnings limit for those collecting benefits before full retirement age. If your earnings exceed this limit, a portion of your benefits may be temporarily withheld. For 2026, this earnings limit has been updated. Knowing this number is essential because exceeding it does not mean losing benefits permanently. The SSA will credit those amounts back later, but in the short term, your monthly payments may be reduced. Once you reach full retirement age, this earnings limit no longer applies. You can earn any amount without affecting your benefits. However, for those who claim early, which many people do at age 62, this rule is important to understand and plan for. Now let's discuss claiming age, one of the most important financial decisions you will ever make. While the basic rules have not changed significantly, the current environment makes it especially important to understand them clearly. You can begin claiming Social Security retirement benefits at age 62. However, doing so results in a permanent reduction in your benefit, typically between 25% and 30%, compared to waiting until full retirement age. Your full retirement age depends on your birth year. For individuals born between 1943 and 1954, it is 66. For those born in 1960 or later, it is 67. For others, it falls between those ages. If you delay claiming beyond full retirement age, your benefit increases by approximately 8% per year until age 70. After age 70, there is no additional increase, so the decision is straightforward in structure. Claim early and receive less for life. Claim at full retirement age and receive your full benefit. Delay until 70 and receive the highest possible benefit. The best choice depends on your health, financial needs, marital status, and personal risk tolerance. There is no universal answer, but there are consequences for making this decision without full understanding. Now let's talk about spousal and survivor benefits, which are often overlooked. These benefits are especially important for individuals who may have lower lifetime earnings. If you are married, you may qualify for a spousal benefit based on your partner's earnings record, up to 50% of their full retirement benefit if that amount is higher than your own. If your spouse passes away, you may qualify for a survivor benefit up to 100% of their benefit. These benefits are extremely valuable, yet many people do not fully understand how to claim them correctly. Timing decisions regarding spousal and survivor benefits can significantly impact total lifetime income. For divorced individuals, there are also provisions that may allow benefits based on a former spouse's record if the marriage lasted at least 10 years and you are currently unmarried. Many people are unaware of this and miss out on benefits they are entitled to receive. Finally, be cautious of Social Security scams. These scams are widespread and becoming more advanced. Fraudsters may call, email, or text pretending to be from the SSA. They may claim your Social Security number is suspended, your benefits are at risk, or you owe money. The real SSA does not operate this way. They will not demand payment through gift cards or threaten arrest over the phone. If you receive suspicious communication, do not respond. Contact the SSA directly through official channels. To wrap up, the Social Security system represents years of contributions from you and millions of others. The changes happening today are part of ongoing efforts to update and improve the system. Some changes bring improvements, while others require attention and awareness. The most important thing you can do is stay informed and take control of your benefits. You earned them. You deserve them. Do not let confusion prevent you from receiving what you are entitled to. Stay informed, stay proactive, and continue learning so you can make the best decisions for your future. Subscribe to this channel for more updates and valuable information.